What is a womb transplant? Imagine being told you'll never carry your own child, then discovering that science now offers a second chance. For women without a uterus due to congenital conditions or surgery, a womb transplant can represent far more than just a medical procedure. It can mean the restoration of a dream once thought impossible. A womb transplant, also known as a uterine transplant, is a groundbreaking surgical procedure where a healthy uterus is transplanted into a woman whose own uterus is absent or non-functional. This innovation has revolutionized the conversation around fertility, offering hope to those with absolute uterine factor infertility, AUFI, a condition previously considered untreatable. Unlike traditional fertility treatments such as IVF, a womb transplant goes beyond conception. It enables the possibility of experiencing pregnancy and childbirth firsthand. The donor uterus can come from a living or deceased donor, and once the recipient recovers and begins menstruating, IVF is used to implant an embryo created prior to the transplant. If successful, the recipient can carry a pregnancy to term. While the procedure is complex and still relatively new, its implications are profound. The first successful birth after a womb transplant occurred in Sweden in 2014, and since then, several healthy babies have been born through this method around the world. It is especially significant for women with Mayer-Rokitansky-Küster-Hauser (MRKH) syndrome, hysterectomy patients, or those with other uterine disorders that affect fertility. However, a womb transplant is not permanent. After 1 or 2 successful pregnancies, the uterus is typically removed to eliminate the need for long-term immunosuppressive therapy. This reduces risks associated with rejection and allows the woman to return to normal health without medication dependency. Despite its promise, the procedure raises ethical, financial, and medical questions. It is costly, still considered experimental in many countries, and requires a deep commitment from both donor and recipient. But for those who undergo it, the reward, the chance to become a mother, is immeasurable. If you're someone who believes in the healing power of medical innovation and the right to experience motherhood, the rise of womb transplants should ignite your curiosity. Science is not just extending life, it's now helping create it in ways we never imagined. Would you consider a womb transplant as a viable path to motherhood or support it for someone close to you?